Stalker here from WestfordCAT, and I am with Jeff Stevens, and he is the health director in Westford. And we were having these weekly updates, Jeff, and seems like life got busy or summer came along, and we haven't been talking as much. And now that it seems like there is a rise in COVID cases around the country in Massachusetts and in Westford, I thought it would be a good time for us to touch base again. How you doing, Jeff?
I'm good today, Patty. How you doing?
I'm doing pretty good. Glad it's summer, halfway through, and but you know it's concerning because I was on the Cape last week on vacation, and went out to some restaurants and nobody's wearing masks anymore, and this was something that we had feared that as we start to reopen and stop wearing masks, that there could be an uptick in cases. Can you talk a little bit about that, Jeff? What are we seeing?
Sure can. So, yeah, let's start just a little bit further back. Yeah, we did have our meetings about once a week for a long time, and we dialed back on that because our COVID numbers in early June did get all the way down to at one point just 2 people in town had COVID, and that was great, and it stayed low for some time. But this Delta variant that is out there that you see on the news on a regular basis clearly is starting to really make a push within the community. It is fairly widespread at this point. It's not something we can necessarily avoid. And it's definitely the cause of the outbreak that's occurring in Providence. And it's the cause of some of the other outbreaks.
Provincetown, right? Not Providence.
Yes.
Yep. No, that's okay. So Provincetown, that is on the very end of the Cape in Massachusetts, Cape Cod. Okay.
And it's also the cause of other outbreaks in different parts of the country. It is believed at this point to be far more contagious than the original strain, but it doesn't appear to be any more deadly. The people that are vaccinated are definitely more protected from it, but the vaccination, as we've said from day one, isn't going to prevent you from getting an illness. No vaccine ever has actually truly done that. It prevents you from getting as sick, and the goal is to keep you out of the hospital. And right now, it's the best protection we really have against COVID, and it's kind of doing its job. It's keeping people that do get it only mildly ill, and they're recovering, and some people are asymptomatic. The people that are not vaccinated are the ones that are getting far more sick and are generally the ones that are landing into the hospital and having worse complications. And that's really why it's really important to get vaccinated. If you haven't yet, you'll get less sick and you reduce your risk to yourself and to others.
Are there any vaccines in Westford? And what do the numbers look like in Westford? You said at one point there were only 2 people in June that had COVID. What are the numbers now?
We've got around 20 cases, and we've been at around 20 cases for a couple of days. And maybe a week and a half, we've really seen that jump up. I don't know if this is just another spike or if this is going to continue to rise. It's only 2 weeks into this particular spike, so we'll be continuing to watch. We've always tracked every single case and all of the numbers in Westford. Even when we got down into the single digits, we still paid attention to what that was. And what we're seeing is our percent positivity for people that are getting tested is going up. The problem with that is very few people are getting tested. We were under 1,000 people that got tested in the past 14 days, and we're seeing a percent positivity of 2.5%, which we haven't seen a number like that since before mid-April. So what that basically means is we're clearly seeing a spike. Many of our cases are people that have traveled. Many of the cases we have are very young children that are with their family units. So we're seeing the 1, 2, and 3-year-olds that are getting this, that are with their mom and dad who may have traveled and can't get vaccinated. It's interesting that within our numbers, we're not seeing a lot of teenagers. The ages 6 through 18, there are, I believe right now, no cases in that particular age group. Most of the cases we have under 20 are 20, 30, and 40-year-olds. where you're seeing where they have young kids, and that's where the young kids are getting that correlation with the cases.
Yeah, I see a lot of families out and the kids are wearing the masks and the parents aren't because the parents are vaccinated. And that's what disturbs me about people that aren't getting vaccinated. Um, there's kids that can't get vaccinated. They're not old enough yet. And, that's troublesome to me. And I'm sure the kids are worried as well. So, but what about vaccines in town? Is there anywhere in town where someone can get vaccinated?
So all the pharmacies right now have vaccine available. You can walk in and get it anytime. I I can talk to anybody about that wants to talk about getting vaccinated. If there are questions people have about any reservations they have, uh, our staff, Gail and myself, are more than happy to discuss that with anyone if they're concerned. But the one thing that we also need to look at is at some point, we may be looking at going back into masks more regularly in certain settings. Westford's very fortunate in the fact that we're one of the communities that is vaccinated at about 75% right now,
Great.
yet we still have 20 cases in town. So that tells you how virulent this virus actually is. It's really contagious. So as we move forward, as the state studies the data, and as the town decides to make decisions over the next couple of weeks, we'll be watching and seeing if local mask recommendations need to be put in place again. So it's a watching and waiting game and collecting data. That's where we're at right now.
What a wild year and a half this has been. I don't even remember 2020, quite honestly. But yeah,
It's interesting. I don't know when COVID will actually end. It may never go away for any of us. This may be something that we have to learn to live with. I'm hoping not. I'm hoping it runs a course and it disappears, but right now we're not there. I know everybody thought 6, 8 weeks ago we were close, but that wasn't the case at all.
Well, like you said, it's a watching and waiting game, Jeff, and you and I'll just keep in touch. And I really appreciate the time that you have put in to keep the individuals in Westford updated on what is going on with COVID. I know you guys are just, all out there at the health department. So once again, thanks again for your time, Jeff, and we'll touch base when we feel it's needed.
Sure. And I just want to leave people with one last message. People that are concerned and people that are seeing these numbers jump, while there may not be any mandates at this time yet, please remember that you can implement your own public health measures that actually do work. We've seen them work. Wear your mask, socially distance, wash your hands. Those three things work all by themselves. And that's something that any one resident can control. And you don't need an order to do so. But if you are concerned, wear your mask, socially distance, and wash your hands. That will help.
Great advice, Jeff. I full-heartedly agree. Thank you for saying that. So we'll talk again soon?
Absolutely.
Okay, great. Thanks a lot, Jeff.
Thanks, Patty.
For WestfordCAT, I'm Patty Stalker.